Dr. McNabb here, and I wanted to answer the question today, how would you help somebody with low back pain? Well, there's a few different ways or things that cause low back pain, and the first thing that I'll talk about real quickly is typically like a muscle or a tendon or a ligament. If you strain or pull something, well, then that can be one of the main causes of low back pain. And so if that's what you have, if it's a muscular type or soft tissue type of injury, then usually it'll be more localized or kind of in a smaller area. It won't be like widespread or radiate, and it'll usually last for just a few days, maybe at the most a couple weeks, and it usually tends to resolve itself. Some of the things that you can do to help speed up that recovery is stretching or icing or heating or using a TENS unit or physical therapy type exercises. Some people get a massage, some people do yoga or Pilates. And so those are some of the very common ways and very effective ways that people can treat or maybe even self-treat their low back pain. Now, if your low back pain is more widespread, like it goes across the whole back, or it even comes around to the front, or you kind of feel it radiate even in the stomach or the groin, or it goes down the side of the leg or the butt, or it goes all the way down the toes, that's called sciatica. If it's that type of situation or that type of pain, then what we need is a different solution. Because if it's not a soft tissue thing, if it's more of a widespread or radiating thing, then that's typically some nerve type related issues. That may be a pinched nerve. I'm sure you've heard that term before, or nerve root impingement. And so if that's the case, then we have to figure out what's causing the problem or what's causing the pain, and then treat not just the symptoms, but treat the actual cause. So if we look at your spine and we see that your spine isn't perfectly straight up and down, maybe at the bottom there's a curve in it, or maybe the spine twists, or maybe you've lost some of the curve in your low back, it's supposed to be a little bit more curved, or maybe the hips or the pelvis are tilted or twisted, or they're just off alignment. Well, and that can happen from car accidents or sports injuries to poor posture if you sit all day at work and that kind of stuff. And so if that's what the problem is, and that's producing some pinched nerves, or maybe even a disc problem like a bulging disc or a herniated disc, if that's the problem, then what we need is a solution that's going to help fix that. Because, don't get me wrong, I love yoga and I love massage and I love exercise. I'm an exercise fanatic. But if we have a pinched nerve or a disc problem, then, massage is for the muscles. And so that won't fix a nerve root problem or a pinched nerve. I love yoga, but, as awesome as yoga is, it's not going to fix a disc, herniated disc or bulging disc. So what we need is just a nerve solution, if that makes sense. So the way that we help people mainly, it's not necessarily just treating low back pain from muscle type issues. I can coach you all day long on that, and that's the easy stuff. But the way that we help people with nerve root problems or pinched nerves is by, number one, identifying what's causing the pinched nerves. Like I said, your spine can be curved or twisted, or the hips can be off or twisted. So the first thing that we do is actually take objective measurements, and we take x-rays. Because we have to be able to see exactly what the spine, how it's aligned or misaligned, and what's actually causing the problem. So the first thing that we do is do the examination process, your history, of course, and then we'll take some x-rays should I believe should we lead to think that there is a spine misalignment or hip misalignment problem. And then the solution then becomes treating the cause, whatever that is, whether it's realigning the hips or straightening out the spine or untwisting it or decompressing the discs. Whatever the solution is, that's what we specialize in. So it's not necessarily just treating the effects or the symptoms that you feel, but it's more treating the actual cause of those symptoms. So if you think that you might have a low back issue, or a friend or family member has a low back issue and it's not going away, typically if it lasts more than 3 weeks, it's not a muscular or soft tissue type problem. It's usually probably a misalignment or a pinched nerve type problem. So if you or a loved one or a friend or family member, anybody have one of those, please encourage them, share this video with them, and encourage them to check us out, because that's something that we can definitely help people with. And you don't have to go have surgery, you don't have to have a series of shots or just take painkillers and muscle relaxers the rest of your life. There is a very simple and easy solution, and we'd love to be able to help you out with that. Our contact information is below, and please feel free to ask us if you have any questions. Thanks for watching, guys. God bless.